Hi everyone, I'm Dr. Macherla Abhilaasha, consultant infertility specialist at Art Fertility Clinics, Hyderabad. So, almost 30 to 50% of the people with endometriosis can have infertility, and this endometriosis condition is underdiagnosed in most of the patients. And if the treatment is not taken at the right time, it can become even more severe and it becomes even more difficult for you to achieve a pregnancy. So, how can you know that you might be having endometriosis? So, what are the symptoms of these endometriosis? Number one is if you're having excessive menstrual bleeding. Number two is when this heavy flow is associated with severe dysmenorrhea, that is, severe pain in the lower abdomen. And this pain can sometimes start before the periods and it can even extend after the periods. And number three is painful intercourse. When you're having severe pain during your intercourse, then these are few of the symptoms where you can suspect that you might be having endometriosis. And how it causes infertility. What happens in endometriosis is the innermost layer of the uterus, that's endometrium, will get implanted, means it gets deposited in the pelvic cavity, like on the ovaries, on the tubes, on the bowel, on the bladder, and there it will cause inflammation. It will create inflammation and form a scar tissue, that is adhesions. So these adhesions can be formed between the bowel and the uterus, ovaries and the bowel, ovaries and the tubes. So this will cause distortion of the pelvic anatomy, and because of this there can be problems in the follicle formation, ovulation, and tubes are unable to pick up your egg. There can be blocks in the tube preventing the fertilization of egg with the sperm, and it also affects embryo implantation. And when this becomes more severe, you might require IVF. Thank you.